Hello. Today we are talking about our social policy Medi-Cal Access Program, also known as MCAP, by myself, Isabel Espitia.
Moises Castillo.
Nancy Montejano.
Nicole Ngo.
And Michael Rodriguez.
My name is Nancy, and I will be talking about what is MCAP. MCAP stands for Medi-Cal Access Program. Going out without prenatal care can lead to a lot of difficulties for both you and your baby. This program was created to assist insured pregnant women in obtaining health coverage since women who are unable to access prenatal care frequently give birth to more complicated and expensive children. And Nicole will be continuing the next slide.
MCAP is intended for middle-class families without health insurance whose income is too high to qualify for Medi-Cal. Additionally, those with existing health insurance plans that do not cover maternity services or have a deductible or a copayment larger than $500 for maternity-only care may be eligible for MCAP. As you enrolled in MCAP, your infant is eligible for coverage in the Medi-Cal Access Infant Program for a maximum of 2 years. Unless your child is enrolled in employer-sponsored insurance, has free Medi-Cal, or your income is no longer qualified by the time your child turns 1. The next speaker, Michael, will talk about what services are covered in MCAP.
As stated, I'll be elaborating on what services are covered in MCAP. So the MCAP program covers from the day you applied for health coverage during your pregnancy and 60 days postpartum, which pays for all your medical costs. Furthermore, the newborn is immediately qualified for health insurance from the date of birth through the Medi-Cal Access Infant Program. The MCAP program provides pregnant women with the following types of care, to name a few. These examples include medical care, vision, dental care, prenatal care, prescription drugs, hospitalization, and they cover so much more to support pregnant women. Continuing with how infants are supported by MCAP is Isabel.
The children benefit from this program because their mothers are registered in the program MCAP and they can receive coverage as well under the Medi-Cal Access Infant Program. The duration of the coverage is 2 years starting on the date of birth. They receive hospital stays, vaccinations, well babies visits, and additional benefits from this program. Next is Moises, who is talking about who is eligible for the MCAP program.
So who's eligible for the MCAP program? So to be considered for the MCAP program, some requirements include being pregnant, as well as being a California resident, which means being required to live in California and intended to stay without importance to one's immigration status. One should also not be covered by any other health insurance unless your plan contains a deductible or copayment specifically for maternal care that is more than $500. You are not eligible for additional maternity benefits through private insurance either. Within the MCAP income, which means one must meet the MCAP guideline requirements for monthly household income, which is between $5,325 up to $8,050 in a family of 4. Up next is Isabel with how is MCAP important to public health?
In public health, the goal is to promote and improve people's health. This policy is doing just that by helping middle-income pregnant women across California, providing low-cost health coverage, which allows these women to get the health care they need to make sure that they have a safe and healthy pregnancy and birth. MCAP is important in public health because it is preventing health issues and reducing preventable mortality among women and infants. Many women lose their lives from avoidable pregnancy and childbirth complications. Although this policy is very beneficial for mothers and infants, there are some people who are against this policy. Up next is Nicole with how is MCAP leaving a positive impact on mothers and infants.
MCAP leaves a positive impact on mothers and infants by making sure mothers have a safe pregnancy and that infants are also getting the proper care they need. Unless the baby is participating in employer-sponsored insurance or free Medi-Cal, and you qualify for MCAP, then your baby is automatically eligible to enroll in the MCAP infant program. This is very helpful for infants and mothers as they can continue to receive their support post-birth, also by providing financial support to receive healthcare services throughout the pregnancy. The mothers are able to experience a safe and healthy pregnancy and not stress over financial burdens. The state of California states that all Medi-Cal health plans are obligated by the Affordable Care Act, ACA, to provide a variety of services also known as Essential Health Benefits, EHB. Some of the EHB services that are provided include emergency services, maternity and newborn care, mental health and substance use services, and much more. Moises will continue the presentation by talking about the negative impacts.
So how is MCAP leaving a negative impact on mothers and infants? MCAP is seen as a secondary option to most individuals that use the program, and many mothers attempt to opt out of their insurance plans, usually because of the increases in prices, and they try to use the Access program to work their way around the birthing prices without having insurance. MCAP hasn't done a good job of spreading awareness towards its cause and lacks lots of environment. Medi-Cal has become the go-to insurance plan and covers many medical expenses for Californians, while some insurance plans aren't spoken about as much and perceived to care less for their clients and rated harshly. Next up is Nancy, talking about what key moments promoted this social policy to be brought to vote.
This policy was put to vote because many pregnant women who were experiencing health issues were unable to get insurance or medical attention, which led to a problematic pregnancy. This policy improved access to prenatal care and health care by providing medical class pregnant women and their babies who are uninsured and do not qualify for medical coverage because of excess assets or income that would require them to pay a portion of the cost. And up next will be Michael talking about who enacted the policy.
So going into detail about who enacted the policy, the Medical Access Program was put in place by California's major risk medical insurance programs, which encouraged the passing of a new health insurance policy in California for expecting mothers and their newborn. MCAP is only accessible within the boundaries of the state of California, and it is not available anywhere else in the country. Continuing will be Nancy with what is the history of the policy.
The history of this policy, Medi-Cal Access Program, was formerly known as Access for Infants and Mothers, known as AIM. It was first introduced in January 1922 and offers health insurance to newborns and pregnant mothers who fit this criteria. It helped 3,000 to 4,000 pregnant women a year with affordable coverage. Many pregnant women who were uninsured were unable to obtain health care or coverage. Therefore, this policy was beneficial in helping them do so. And up next will be Nicole talking about how this policy has changed over time.
The policy's name has evolved throughout time as it was originally AIM and is currently MCAP. Also, postpartum care was covered by the policy until the 60th day following delivery is something that MCAP no longer does. The MCAP infant program's prerequisites have also been somewhat altered. Specifically, the baby can now join the MCAP infant program without the family income threshold having to be satisfied, which is different from what AIM required. According to Covered California, back then the MCAP infant program and AIM didn't have a family income limit for the first year, but the second year required families' income to be up to 322% federal poverty level. That being said, this policy for the most part stayed the same. Last but not least, Isabel.
So I'm going to be saying what life stages does it impact and how. It impacts all life stages in some sort, but mainly conception and adulthood. According to McGraw-Hill, it states the indirect consequences of a mother's stress on the fetus can include an increased risk of the mother engaging in risky behaviors, such as substance use and receiving insufficient prenatal care. With that, it can affect a baby by eventually leading to cognitive and emotional issues. It can also lead to children having disorders like ADHD and etc. It impacts adolescents as well because it helps mothers stay out of depression, which can help with decreased risk of miscarriage, low birth weight and full-term offspring, and risk of being on the autism spectrum due to antidepressants. MCAP could help with all these impacts by helping a mother receive the help that she needs, whether it's dental benefits, health benefits, or vision benefits. With MCAP supporting a mother with these benefits, it helps them stress less and worry more about taking care of themselves. On next is What Connections Are There Across the Lifespan by Michael.
So I'll be elaborating on some of the connections that our policy connects with across the lifespan. So our policy connects to the later stages of the lifespan, such as early adulthood, specifically teenagers, where mostly women tend to become pregnant for the first time around the ages of 15 to 19 years old. Teen pregnancy presents health concerns to the mother and child. Teen moms are more likely to have low birth weights, which are a major contributing factor to infant death, as well as neurological issues and early illness. This indicates that the child's quality of life is negatively impacted by the majority of teenage moms who become mothers for the first pregnancy. Furthermore, the child's early life stages, prenatal development, infancy, and toddlerhood, and early childhood may also be impacted. This policy would give financially struggling pregnant mothers and their unborn children a chance at a better and more stable life by making sure they get health coverage. I'll be continuing and talking about what areas of health and wellness does our policy connect to. The areas of health and wellness that our policy connects to are mental health, finance, and health promotion. It connects to mental health in the sense of how women are able to have a sense of mental relief because they're able to get health coverage and have a sense of security. Next is financial wellness. This is achieved by providing low-income pregnant women with financial help and support. Lastly is health promotion. MCAP provides health promotion by promoting affordable and equal access health coverage for pregnant women. This promotes a healthy living and advises pregnant women seeking help to register. Lastly will be Moses talking about changes that can be approved to MCAP.
So some changes that can be made over to improve MCAP would be MCAP should be well known and improve their advertising, since lots of mothers have low confidence about MCAP and believe it's a secondary option. MCAP is seen as a secondary option to try to save money, since their insurance plans usually raise prices and it just gets too expensive for them. There should also be more providers nearby pregnant mothers with good reviews to build credibility within MCAP. MCAP should also address and reassure families about any issues or problems that are called out within MCAP to build confidence within the MCAP program. Next up are references, and thank you for listening.